When it comes to hair on the face, chin hair is the most annoying hair for anybody, especially women. Today we're going to be talking about chin laser hair removal, what to do before, what to do after, what to expect during your treatment, and much more. Hi everyone, my name is Dr. Degha Fongod. I'm a cosmetic doctor in the Northern Virginia area, and today we're going to be talking about chin laser hair removal treatments. So usually women have chin hair. It could be because of PCOS, or they could just have hirsutism, and typically chin hair tends to be very thick. And so when women have chin hair, for some women, thick hair can lead to ingrown hairs, and then that can lead to hyperpigmentation for women of color and also scarring. And for women who don't have skin of color, it's just very annoying, and they tend to pluck, wax, shave, and a lot of times it's just very annoying. So women usually seek out laser hair removal treatments to get rid of this hair. So I always tell my patients, chin hair is hormonal hair, which means that it's not going to react the same way that your body hair is going to react. Specifically, it's going to take longer to treat chin hair than it will to take your leg hair, for example. Normally on the face, we have vellus hair, which is thin hair with very little pigment. However, when you have hair on your chin, especially as a woman, the reason for that is because you have more androgens in your body that are causing the vellus hair or the thin hair to get converted to thicker hair. And so because there's a hormonal component to it, it might take a little bit longer to treat this particular hair. But it is treatable, especially with laser hair removal. And the reason why I love doing lasers for this particular treatment is because it doesn't only help with hair removal or hair reduction, it also helps with hyperpigmentation and the scarring in that area. Because, for example, if you're a person of color, we use ND-YAG lasers in that area. And ND-YAG lasers are not only great for hair removal, but they can also help with some mild pigmentation issues and scarring. So that's one of the reasons why I love doing laser hair removal on the chin. Before you come in for your treatment, I would want you to shave. And obviously, if you're using any retinoids on your face, then you will want to stop using that at least 2 weeks prior to treatment. Also, it's important to let your practitioner know if you're on any antibiotics, because that can predispose you to having burns on your face. So disclosing antibiotic use is very important, and making sure that you discontinue any retinoids is important prior to getting your chin laser hair removal treatments. Now, once you come in for the treatment, usually it's a very fast treatment. I will insert a clip right here just showing how fast the treatment is. Typically, it doesn't take, at least for me and my machine, it doesn't take more than a minute for me to complete a chin laser hair removal treatment. After the laser hair removal treatment, some people can develop little bumps on the skin, also called perifollicular edema, which is normal. In that case, we will use some aloe vera gel to calm the area, and we also recommend that you use a 1% hydrocortisone cream on the area to prevent any hyperpigmentation from occurring after the treatment. It's also a good idea to use this hydrocortisone cream at home when the hair starts to come back in. Usually it's going to feel a little bit itchy, and so it's a good idea to have that on hand to help calm the skin so it can prevent further hyperpigmentation from happening. We do these treatments every 4 weeks. I always recommend a minimum of 6 treatments, but for the chin hair, typically I would say most people need about 8 to 12 treatments before they can get complete resolution of the hair. Obviously, if you have gray hair or red hair or super blonde hair, typically laser will not work for you in this area. So I tell my patients, come in before the hair gets gray. For my Caucasian or white patients, I recommend an Alexandrite laser. And for my Asian patients, especially East Asian, Chinese, Japanese, Korean, a diode laser is great. But if you have darker skin, so brown skin and black skin, or if you have multi-ethnic skin, I recommend an ND-YAG laser. I have an Alexandrite and a YAG laser at the office, so I'm able to treat everybody. But that's my recommendation for chin laser hair removal. If you have any other questions about chin laser hair removal, let me know. If you're in the Northern Virginia area or the DC metro area and you're looking for some place to get your laser hair removal treatments done, then you can definitely come to my office, Delight Medical and Aesthetics, and I will gladly help you out. Until next time, bye.